Leave it there and take you live to Canberra now to Chief Medical Officer Paul Kelly.
Give you the update on the latest information from the COVID-19 pandemic here and internationally. Start with international first. There are over 77 million people that have been diagnosed with this disease in this year, since the start of January. Over 1.7 million deaths. We should keep those figures in our mind as we think through what's happening in the Australian context. In the US alone, there are over 200,000 people diagnosed yesterday. Their hospitals are absolutely chock-a-block full. Their ICUs are overflowing. That is a very different situation here in Australia, even despite the hotspot that we've seen in recent times in the northern beaches of Sydney. So there were 21 new cases diagnosed in Australia yesterday. Most of those, well, several of those, I'll get onto that in a minute, in New South Wales and related to the New South Wales hotspot. But importantly, there's been no new deaths for some time. Hospitalisations remain extremely low. There are only 22 people in Australia right now in hospital. No person in intensive care, and therefore, of course, no one on ventilation. So there's been no changes in that, despite the cases that have occurred in relation to the New South Wales event in recent days. So in the past 7 days, we've had 173 cases. Of those, it's roughly half have been in the northern beaches of Sydney and that related cluster, plus the rest in overseas quarantine. Testing, and I really want to emphasise this as well. We are doing an enormous amount of testing. Yesterday was, we believe, a record. I'm pretty sure it was a record for any state since the beginning of the pandemic. 44,000 tests in New South Wales alone, 76,000 tests across Australia. So that's how we're going to find this virus. We really, all of my Chief Health Officer colleagues have been stressing this in their own states. We really want you, if you are symptomatic, get tested. If you are asked by any of the health authorities around Australia, but particularly in New South Wales right now, because of the linkage, perhaps with a place of interest or a close contact with someone who has this disease, get tested. That's how we know where this virus is and where it might be spreading. So those are the figures for today. In terms of New South Wales, 8 new cases diagnosed in the 24 hours to 8 o'clock last night. That brings up to 90 the cases related to the Avalon cluster. 92 in fact now, so 90 of those are close contacts with the known places where the transmission has happened, and 2 others are residents of Avalon, one of the adjacent suburb of Palm Beach. There is a second area of concern. There is a nurse that has been part of the transport from the international airport to the quarantine hotel, who was found to be positive, and so that we believe at this stage, but that will be confirmed by genomic analysis later today, is a different cluster to the Avalon cluster, but that's obviously a crucial component of the investigation that New South Wales Health is currently undertaking. So we're watching that with great interest. Also, the case, the teenager that was diagnosed in Victoria, again associated with that Avalon cluster, they did everything perfectly correctly. They heard that news about the Avalon issue. They'd been at one of those places of interest. They isolated and got tested. This is what we need. Anyone that has been in the northern beaches area, particularly in that Avalon and northern part of the northern beaches, LGA, since the 10th of December. Please isolate and get tested wherever you are. The Australian Health Protection Committee has been meeting every day since last week. We met again just a few minutes ago. I've come straight from that meeting where we discussed particularly the New South Wales issue, but also this emerging concern with the changes to the virus, a variant of the virus which causes COVID-19 in the UK. So we'll be issuing a statement, hopefully later on today, in relation to that. Our view is that this is a concern in the UK. Certainly their scientific groups met overnight. It is a new variant of the virus. But here in Australia, we have our ways of dealing with people coming from overseas in terms of our hotel quarantine system, and that has been extremely effective in controlling any virus that may be coming from other parts of the world. And so we put faith in that. We don't believe there's any reason to change our border arrangements in relation to people coming from the UK. We have a lot of Australian citizens that live in the UK right now are wanting to come back to Australia, and we're still welcoming them. They will be going into 14 days supervised quarantine. So just to give you an idea of the numbers there, we've had since March over 200,000 people have come across the border back into Australia, most of those Australian residents. So 200,000 have arrived. Almost 2,500 cases have been diagnosed in hotel quarantine. And we have 4 cases that we know of this new variant strain, which may be associated with further transmission or more increased spread. But if you are a person coming into by yourself into a hotel room for 2 weeks, you're not going to transmit that out of that room. And in most of the cases, for most of the time, our quarantine system has been very safe and effective. So that's related to that. Just another couple of things on that virus, the variant. There's no evidence at the moment that it has any effect on the severity of the illness from the virus. There is no evidence at the moment that it interferes with the vaccine. There is no evidence at the moment that it interferes with diagnostic tests. So that's the truth of it. We're obviously looking closely, but at the moment there's no need for this to be a cause of us changing any of our arrangements here in Australia or to be concerned about people coming from the UK